All right, let's dive into a part of your body that is absolutely central to pretty much every single move you make, but honestly is so often misunderstood. We're talking about the pelvis. Today, we're going to look at this architectural marvel and ask, could it be the secret sauce of your stubborn back pain? Think about it. You get that nagging, deep ache in your lower back. Your first thought, my first thought, almost everyone's first thought is to blame the spine, right? The lumbar vertebrae, a disc, something like that. But what if the real culprit isn't your spine at all? What if it's the very foundation that your spine is sitting on? That's the big question we're digging into. And to really get this, we kind of have to think like architects for a minute. So in this first section, we're going to look at the pelvis not just as a bunch of bones, but as the master keystone of the entire human body. Okay, so check out this idea of the pelvic ring. It's just like the keystone in an old Roman arch. You have the sacrum, that's the triangular bone right at the base of your spine, and it is perfectly, and I mean perfectly, wedged between your two big pelvic bones. Those connection points, that's what we call the sacroiliac or SI joints. And believe me, this design is no accident. It's a total masterpiece of engineering that creates this incredible built-in strength. Now, this brilliant design, it has two massive jobs. First, it's basically a load transfer station. It's managing all these huge forces traveling from your upper body, down through your spine, and out to your legs whenever you're standing, walking, or running. And second, it's a shock absorber. It buffers your spine from the constant pounding and jarring that comes up from the ground with every step. So it's not just strong, it's incredibly smart. Okay, so we've established it's strong, but here's where it gets really, really cool. This structure isn't just strong. It's actually designed to lock itself into place. It's like a living puzzle that creates its own stability from the inside out. And what's wild is how that puzzle actually changes as you get older. In a kid, the surfaces of these sacroiliac joints are pretty smooth, which makes sense, right? It allows for more movement and growth. But as we get older, these surfaces develop all these unique ridges and grooves. They literally grow into each other to form this interlocking puzzle piece fit. You sacrifice a little mobility, but you gain incredible strength. And this built-in stability, it actually has a name. It's called form closure. The best way to think about it is passive stability. It's the strength that comes just from the shape and the fit of the bones themselves. The puzzle pieces are locked together just because of how they're designed. It doesn't require any muscles to hold it there. It's like the skeleton's own brilliant failsafe. But of course, we are not statues. We don't just stand still all day. Our bodies have to constantly adapt to different loads and all kinds of movements. And that is where a second, much more active system comes into play. We're talking about the muscles and ligaments that act like a dynamic bracing system. This active system is called force closure. So if form closure is the interlocking puzzle, think of force closure as this smart, high-tech corset that wraps around your entire pelvis. It's the dynamic compression that gets generated by your muscles and ligaments, and it tightens everything up to stabilize the whole structure, especially when you're moving or, say, lifting something heavy. Now, here is a mind-blowing fact for you. There are no muscles that can directly move your SI joints. Zero. Instead, all that stability comes from these big slings of muscles that cross the pelvis in these diagonal patterns. So for example, your big lat muscle on one side of your back works in sync with the glute on the opposite side to create this stabilizing tension right across the back of your pelvis. It is an absolutely ingenious system of pulleys and levers. So here's the bottom line, the crucial point to all this. You've got the passive stability from the shape of the bones, that's form closure, and you've got the active stability from all those muscle slings, that's force closure. You put them together, and what you get is a remarkably strong, self-bracing foundation for your entire body. So this system sounds pretty perfect, right? But what happens when this beautifully balanced system gets thrown off? Well, as we're about to see, even the tiniest, most subtle shift in this keystone structure can lead to some really big problems. 7 degrees. That's it. That is the total amount of movement that's available at your sacroiliac joints. Now, I know that sounds like almost nothing, right? But these tiny micro movements, these subtle little glides and rotations, they are absolutely critical for everything from walking and bending to absorbing shock. These tiny movements are basically 2 nodding motions. So first you have nutation. That's when the sacrum nods forward. This is the joint's most stable, locked position. It tightens all the ligaments. Then you have counternutation, which is when it nods backward. This is the unlocked position, which is way less stable and needs more muscle support to control it. A healthy pelvis is just fluidly moving between these two states with every single step you take. So, what can go wrong? Well, it's often not some big, dramatic injury. It can be something as simple as stepping off a curb you didn't see coming, or a slip on the ice where you land hard on your butt, or that classic lift and twist motion that we're all warned about. And for women who are pregnant, hormonal changes can make the ligaments looser, which makes the joint way more vulnerable to getting knocked out of its happy place. And this is where things get really, really tricky. When the SI joint is the problem, the pain often doesn't show up right at the joint itself. It refers elsewhere. It creates this confusing pain pattern that can totally mislead doctors and therapists. The most classic sign, the number one thing to look for with an SI joint issue, is a deep, dull ache right in the buttock. But that pain can also show up in the back of the thigh, in the groin, or even in the lower back itself. But here's a key clue. The pain very rarely travels below the knee, and that helps us tell it apart from classic sciatica coming from the spine. So, all this brings us to our last section. How do you actually figure out if the pelvis is the problem? Well, as you can imagine, it takes some pretty careful detective work. This quote from our source material really just sums it up perfectly, because the symptoms overlap so much with way more common issues in the hip and the lumbar spine. A diagnosis often comes from first proving what it isn't. So the whole diagnostic process really boils down to two key steps. First, any skilled clinician is going to do a super comprehensive exam of your lumbar spine and your hip to rule them out as the source of the pain. Once those are cleared, then they move to step 2. Using specific physical tests to gently stress the SI joint and see if they can reproduce that familiar pain you've been feeling. So what's the big takeaway here? We hear the phrase core stability all the time, and we immediately think of six-pack abs, right? But true, deep stability, that's not about superficial muscles. It is built from the inside out, and it starts with the proper function of this foundational pelvic keystone. So if you're battling that chronic back pain, maybe it's time to look beyond your spine. And that leaves us with one final thought. If your core is only as strong as its foundation, maybe it's time to ask yourself, is my keystone secure? If you're dealing with persistent pain, it might be worth talking about this very possibility with a qualified healthcare professional.